Good evening, everyone. This is Dr. Josh Goodwin here at Regenexx Las Vegas. We're going to get started on the webinar tonight, which, as you can see on the screen, we're going to be talking about non-surgical treatment options for the shoulder. So essentially treating orthopedic shoulder conditions non-surgically with orthobiologics, which we'll get into. Just a little overview of the format. Just going to get into who I am. We'll talk a little bit more about shoulders and the different anatomy and conditions that can happen with the shoulder regarding pain and dysfunction. We'll move into discussing a little bit of the current treatment options for some specific conditions, and then get into some of the treatments that we provide here at Regenexx, our process for evaluation, and then we'll have some question and answer time at the end. So please feel free to write down any questions in the webinar chat or Q&A section, which I will get to at the end if there are any questions. So please feel free. The goal of the webinar is obviously to be just educational, help plant the seed in your brain about different approaches to treating orthopedic conditions outside the usual information you get at your orthopedic doctor's office or primary care, and just to help you kind of understand sometimes there's more options to think about than some of the things that are traditionally done. So a little bit about my background. So I grew up in New Mexico. I stayed there for medical school. I am a medical doctor. I did my residency training in a non-surgical field called physical medicine and rehabilitation. So I am board certified in that. I did do fellowship training in sports medicine and interventional spine. While I was there, we did perform some regenerative therapies for different sports injuries and orthopedic conditions, to include low back pain, disc degeneration, rotator cuff tears, elbow injuries, knee injuries, foot, ankle, all those kind of things. So I've been with Regenexx since 2015. I was at first at the Iowa clinic. Now I'm at the Nevada clinic. Been here since 2018, and I'm a co-author on a review article discussing different treatment options, stem cell based for low back pain and disc degeneration. So just to jump right into it, obviously we're talking about the shoulder today, so it's important to understand what structures make up your shoulder. So we have our bony anatomy with our humerus and our shoulder scapula and our clavicle, and these form your glenohumeral joint, your acromioclavicular joint. Between the joints there is cartilage, which is the cushion of the joint. Your shoulder blade does articulate with the ribs, and your clavicle does attach to your sternum as well. We have our soft tissue components to include kind of joint capsule ligaments. We have our rotator cuff tendons. There's 4 of them, 1 on the front, subscapularis, 1 on top, and 2 in the back. We have our long head of our biceps that attaches inside the shoulder, and then our shoulder joint has a rim of additional cartilage called the labrum. And again, like this picture showing, there's capsule ligaments and things as well. So all of these different structures can be involved with different types of shoulder pain and dysfunction, which we'll talk more about. Conditions that are associated with the shoulder that can be painful. We hear about arthritis. Those rotator cuff tendons can have tendinitis. They can have tendinosis or tendon degeneration, which can become painful. And they can also have tearing. We can get a condition called frozen shoulder, which can be a result of injury or tearing, underlying arthritic change, anything that creates inflammation in the shoulder It can also be idiopathic, meaning we have no idea why it occurred, but can be associated with conditions like diabetes, labral tears, bicep tendon tear and tendonitis, bursitis, shoulder instability, whether it be you're just born with instability or have connective tissue disorders or from trauma. You can have bony fractures and other nerve injuries that create shoulder pain, which may be focal to the shoulder or coming from the neck and being a referred pain issue related to nerve dysfunction. So we're really only going to talk about a couple conditions with with the shoulder and associated treatments with these. Shoulder osteoarthritis is a very common condition. You can see it affects more than a third of people over 60 years old. We get tissue wear and tear and cartilage loss and irritation. This can lead to inflammation, and this can drive a continued process of tissue breakdown, which then can start to affect the underlying bone, the surrounding capsule tissue, and synovial lining. And then we'll start to see a loss of joint space when we get more significant cartilage loss. This is an x-ray of someone with what you would hear bone on bone or full thickness loss of cartilage. We do have to remember that osteoarthritis is really a combination of structural problems, so the cartilage destruction and the associated bony and joint changes. But this is also accentuated by a chemical response to some of those structural changes, which then can lead to disuse from pain, and you can get periarticular weakness. This is important in the sense that sometimes just affecting the negative chemical balance inside an arthritic joint, you can get significant improvements in pain and function by just altering the chemical environment, even if you don't completely restore the underlying tissue degenerative changes. We have to remember that cartilage has no nerve innervation, so the wearing down of cartilage is not necessarily a painful phenomenon. It's only when other things start to get affected, like bone, joint lining, nerves, inflammation, instability. These kind of things can start to drive dysfunction. Now, as I mentioned, we're going to talk a little bit about the rotator cuff. We'll get more into that, but we can have tendon inflammation, tearing, or just tendon degeneration, which then can become painful as well. There are 4 rotator cuff tendons. You have one on the front, subscapularis, one on top, your supraspinatus, the most commonly injured. You have 2 posterior rotator cuff tendons, the infraspinatus and teres minor. Again, we talked about it's very prevalent. So over 30% of people over 60 have a rotator cuff tear, and more than 2/3 of people over 80 have a tear. These can be through traumatic or degenerative process. And what I thought was kind of interesting is only about 1/3 of rotator cuff tears are actually symptomatic or painful. And when they are, they can be very painful, and you can have weakness with movement if they're more complete tears. This was a study just kind of highlighting the fact that just because you have a tear does not mean you're going to have symptoms. So of the people studied, the majority of the tears, 65%, were asymptomatic, meaning just no pain, while only 35% of them had discomfort and pain. And just in the general population, there's, more than 1/5 of us walking around with rotator cuff tears. And again, most of us don't even know it. It's just to say that just because you have something on imaging doesn't mean it's your cause of your pain or that you have to jump into surgery. Now, a lot of us might be familiar with the traditional, treatment options for orthopedic shoulder conditions. We have medications, physical therapy. When these fail, we might get a corticosteroid or a cortisone injection. which we'll talk more about. And then sometimes we'll lead into surgery for rotator cuff repair or a shoulder replacement if it's more of a significant arthritic condition. Now, things to consider with injection-based therapies for the shoulder, they're really only kind of traditional insurance-covered injectable solution is a cortisone injection. Now, this is a strong anti-inflammatory, and while it can help with pain, it is associated with a dose and frequency dependent toxicity to the shoulder and really all joints that you inject cortisone into. It can be really negative for people that are diabetic, associated with weight gain, flushing, anxiety. It is locally toxic to cartilage, especially with high repeat dosing. It does progress arthritis. It can weaken the bone and create osteonecrosis and rapid joint destruction. And it can be important to avoid cortisone injections if you're ever even considering a surgery, because it increases the complication rate. I'm surprised at how often it's done before surgery because of some of the things we see here. So there's an adverse impact of steroid injections in rotator cuff healing for those that are going to undergo rotator cuff repair. So just one shoulder cortisone injection within 6 months of a rotator cuff surgery increases the failure rate of rotator cuff surgery, which means more surgery, and it increases the surgical infection rates. And so this study basically recommended that if you're going to be considering a rotator cuff repair, you should avoid steroid injections within 6 months of surgery. The same thing goes for joint replacement. A cortisone injection really within 1 month. Most surgeons want 3 to 6 months from the time of a shoulder surgery, increases post-surgical infections, and that increased risk can persist up to 12 months after the surgery. So it just goes to show that these are not healthy injections and they're best to be avoided when possible. Now, when we're looking at surgery, and some people need surgery, obviously sometimes that's the right choice, but it's good to go into these different options well informed. So for arthroscopy or rotator cuff repair, complications rates can go from 10 to 18%. For rotator cuff repair, depending on the duration of follow-up, rotator cuff re-tears can be as even more than 66. So 2/3 of the patients at 10 years can re-tear their rotator cuff. Stiffness is the most common issue. Infection can happen, worsening pain, neurologic injury. For shoulder replacement, in this specific study, the complication rate was about 12%. There was hardware loosening that looked like it happened within 5 years, which can lead to repeat surgery and revisions. Shoulder instability was not uncommon. Shoulder fractures around the prosthesis. Nerve injuries can happen, infections, death, all these things can be part of these types of surgeries. Anesthesia risk. Now, we also have a safety study that was published with a 10-year follow-up of 2,300 patients. And because everything we do is injection-based, the complication rate was only 0.17%. So, we have to weigh all of these different considerations when making decisions on how we're going to address our orthopedic condition of our shoulder. So the Regenexx approach is really joint preservation. What can we do to improve the tissue of your shoulder, to reduce inflammation, strengthen, regenerate if possible? What can we do to keep that tissue strong, healthy, and viable for function? So a little bit about Regenexx. Regenexx has been around since 2005, one of the first clinics on a large scale treating all orthopedic conditions with orthobiologics and stem cell-based treatments. There's now more than 90 clinics, and we've always been dedicated to research and advancing the field of interventional orthopedics, so non-surgical injection-based treatment. These are all of the clinics around the US and internationally. Obviously, we're right here in Henderson. And just a 30,000-foot view, we have always been involved with innovation in the lab, performing clinical research, tracking patients in a registry. We publish on this information, and we use it to help guide our decision-making with our patients in the clinic. So this is very helpful to understand how our procedures are helping or not helping patients. What are the success rates? What are the conversions to surgery? All those kind of things can be very helpful in having a good discussion with patients and ensuring that they are well informed based on actual data. So we're currently tracking more than 90,000 patients as an organization in our registry, and there's more than 8,100 patients being tracked with different shoulder conditions. So really, we're really just trying to advance orthopedic care and essentially have that natural evolution of medicine where we're trying to progress from more invasive to less invasive as we learn more about ways that we can take advantage of our natural healing mechanisms. So we just use minimally invasive needle injections using healing factors such as bone marrow concentrate, which contains stem cells, platelets, growth factors. And as time goes on, we'll get more and more products that will be available to help treat orthopedic conditions. Again, with the goal of tissue preservation, minimal risk, less downtime. So that's kind of the goal, to help reduce the exposure to all the potential complications of more invasive surgery, or to things like cortisone, which, as you saw, has its own downsides. So some of the Regenexx treatment options, some of the main ones are PRP and bone marrow concentrate. Bone marrow concentrate contains mesenchymal stem cells that we use for more advanced conditions. We can isolate a lot of these cells from your own body. So we all are aware of the fact that we can heal, whether it be a cut on your skin, a broken bone, or even with surgery, you have to heal from surgery. There's soft tissue incisions, there's cutting, there's removing tissue, there's stabilizing, but your body still has to heal. And there are cells involved with the response to the healing, the activation, and the generation of new tissue and collagen. And some of these things can be just extracted from your own body and utilized in areas that are having some trouble, either from degeneration, overload, injury, or just overuse. And so one thing that we inject are your platelets. So it's called PRP, or platelet-rich plasma. If we look closely at some of the growth factors contained within platelets, platelets are the activators of healing. And so they contain these growth factors that are the triggers and the signals for a lot of the healing processes to take place. We have growth factors that help with cell growth, new blood vessel growth, tissue repair, collagen production. We utilize this for mild to moderate shoulder arthritis, tendinitis, bursitis, small partial tears in the labrum or rotator cuff. And this directly stimulates the tissues, can help again with that negative chemical environment that is developed with arthritic degenerative conditions, and make that environment more healthy and conducive for less pain. As I mentioned, we also inject bone marrow concentrate, which does contain mesenchymal stem cells. Now, in the lab, these cells are self-renewing, and they do have the potential to transform into different tissues based on their environment. In our bodies, they do respond to the environment. They help direct tissue repair, kind of like a contractor at a construction site, helping kind of organize what's needed for tissue repair. And as such, they have a little bit more potential for improvement. And we use them for moderate to severe arthritic changes, larger tears, or if you got good but partial improvement from PRP, we can escalate care to utilize bone marrow concentrate and the mesenchymal stem cell solution to help treat those conditions. So these are the two main injectable solutions that we use within the clinic. We talked about some of the indications for either one. And again, our goal is joint preservation. Obviously, with that, pain improvement, functional improvement that comes along with preserving and strengthening your own orthopedic tissue. So what's the data? As I mentioned, we do have a large registry. We're tracking more than 8,100 patients. Function improves significantly. Pain is significantly reduced even over the first month and continuously gets better with some sustained improvement. Some of the registry data goes out to 6 years. And even after 3 months, the average reduction is about 51%. So that means there's some people at 100% and some people less, but that's an average improvement. There's been lots of randomized controlled studies looking at PRP, comparing it to your traditional options like steroid injections, saline gel injections, other types of injections, dry needling, exercise, prolotherapy, physical therapy, showing PRP to be superior to the majority of these different interventions that most people have already been exposed to. We have published other studies utilizing the bone marrow-derived cells as well as the platelets in a randomized fashion with 2-year follow-up for shoulder rotator cuff tears with really good outcomes. 90% of people met the minimally clinically important improvement that was sustained for 24 months. 73% showed evidence of healing of the rotator cuff tear on MRI. There was no serious adverse events, and only 1 patient converted to surgery through the 2-year follow-up. So definitely things to consider. These were for partial to complete non-retracted rotator cuff tears. We also have a registry study of more than 100 patients tracked over a couple years, which showed, again, an average improvement of more than 50% through the follow-up period. And this was, again, using bone marrow concentrate, as we discussed. Now, what's the process? Anytime you have an orthopedic condition, there needs to be a process by which you are evaluated to see if you're even a candidate for a specific intervention. And that should go for all interventions, whether it be steroid injections or surgery. There needs to be a defined evaluation process and a thorough discussion of what your problem is so that you understand what's going on and why your symptoms are what they are, and then what are the options. And so we have hour-long consultations, we review imaging, we perform diagnostic ultrasound, and we discuss the options. And this is where we customize our treatment plan. Now, when we're specifically considering PRP or bone marrow-derived treatments for shoulder conditions, not everybody's a good candidate. Some people might be low candidates, and we have to have a discussion based on what that means regarding success and limitations. Now, if we move forward with something like a PRP procedure, this is more of a one-day procedure where there's a blood draw processing. Now, this is important. We do not use automated machines, which are one-size-fits-all machines. We are all different. We see people that are young and old. We see mild and severe conditions. We see bone and cartilage problems, and we see tendon ligament issues. All of these different factors can lead to the need for different products, dosing, concentrations, different types of PRP. And so in order to be able to serve people and to provide the best optimized, customized treatment, having a flexible lab platform allows us to do that because we can customize the type and the concentration based on age, the severity of the injury. Is it soft tissue versus cartilage bone type tissue? And then the injections are always done with image guidance so that we're treating precisely and placing the cells directly where they're needed. Now, sometimes if we need to perform the bone marrow concentrate procedure, it can be a little more involved. Specifically, if you have a more severely arthritic joint, then there's a 3-step process. If you just have an isolated, say, rotator cuff tear, you don't always need the 3-step process. And so basically the 3-step process is prolotherapy, which is basically a pro-inflammatory agent to help stimulate your body's response to the joint to pre-activate the healing cascade. The next day or 2 days after that, we perform the bone marrow aspiration, 30 to 40 minutes, well tolerated. We can use twilight sedation. Then the cells are processed. We count the cells and assess viability because dose matters. And then again, we inject guided precisely into the problem areas. 3 to 7 days after that, we will inject with PRP to help kind of fertilize and provide some additional growth factors. Now, a lot of people are concerned about bone marrow aspiration. It's a very safe procedure, mild to no discomfort, as long as you have good local anesthesia. But we do offer twilight anesthesia as well to just take your comfort to the next level. Everybody does really well. In the past 10 years, I've had 2 people that had more moderate discomfort, and it lasts maybe a day where there's some muscle soreness. So it's a very well tolerated procedure. Now, after you get the specific concentration in the cells that you need, again, you have to deliver these to the precise location that's creating the problem, directly into the tear of your rotator cuff, directly into your joint or around your bicep tendon, or directly into your labral tear. It needs to be precisely given. And you have to use image guidance. This is an X-ray showing good flow into the shoulder joint and injecting the superior labrum. Here's an ultrasound showing a needle injecting a supraspinatus rotator cuff tendon tear, and the cells flowing through that tendon tear. That little cloudy movement there is the bone marrow concentrate solution flowing through this tear of the rotator cuff. Now, post-procedure, we do expect that people are going to have some days of stiffness and discomfort. Most people will need physical therapy. For larger tears, we will put people in a sling for a couple weeks. We will provide some pain medication as needed. In general, there'll be 2 weeks where we have to just really work on range of motion, reducing specific activities that really stress the tissue significantly. Again, for more large tears, that's where it'll be more restrictive. We follow up every 6 weeks to make sure people are doing better. There's always some people that will need more than one treatment, where the first treatment helps, but only partially. But you can only make those decisions based on proper follow-up. So just for some rotator cuff tears, that's on our website with pre and post treatment, some with PRP, some with bone marrow derived cells. So large rotator cuff tears, seeing some change in healing on pre and post MRI. So I just want to get into the questions and see if anybody has any questions for me. As I mentioned, some people will need more than one treatment. Most of these procedures are not really covered by insurance. Cost range can be $1,500 up to $6,000 or $7,000, depending on what you're doing. Regenexx is one of the only organizations that does have coverage through self-funded employers. We're probably close to 3,000 employers that cover these different procedures for their employees. And that's going to continue to grow. And so hopefully a lot of that information will help drive other private insurance companies to add additional options for patients outside the things that we covered that, again, are not necessarily without their level of consideration and risk. Here is some contact information for our patient education and scheduling center for new patients. If you've been to the clinic before, you can always just reach back out to the clinic. If you've had a procedure before, you have my direct email and my cell phone and the clinic number. But if you're a new patient and want to get more information, you can reach out to Danielle. Here's her email and her phone number. She can help guide you on next steps. How do you get in for a consultation? How do you get us imaging you've already had if you want us to review it prior to scheduling a consultation, to ensure it's worth your time? I don't see any additional questions at this time. Feel free to reach out to Danielle or to the clinic directly, and we can assist you with answering your questions. I hope you learned some new information about some different treatment options, and if we can help, please feel free to reach out. I appreciate your time. Have a good evening. Thank you.